So last year you were here in Reno. You came to my talk. We talked about lasers. Came back. You purchased one. Tell me how it's been going.
So I manage a facility that has about 70 horses on property. I'm the barn manager. So I wanted to be able to treat our personal horses. But now I also treat our clients' horses with any injuries or swelling or tendon tears,
Sure. Yeah.
anything
Anything that
like
comes out.
that.
Yeah.
I treat them, and the veterinarian will come in and diagnose,
Mhm.
and then I rewrap them for the day, or whatever swelling is swollen, I will
Sure.
laser multiple times a week until it starts to look better, and from there.
I love that. What you're describing there, that flexibility. I think it only is accentuated by the fact that it's so portable
Right.
and you can get around. And with me, with primarily using on dogs and cats, I can kind of get around mine, even the mastiffs, that they're within arm's reach.
Yeah.
But for you, sometimes, especially injured horses, tell me a little bit about that. Cause that's
I
gotta be
don't
tough.
necessarily
Yeah.
and I feel like if I have to get out of the way quickly because they tell me they're done or whatever,
Mhm.
I feel like I don't have to move a ton of equipment out of the way as well. I can just kind of get up and go.
Yeah.
And it's here with me, and it just kind of is easy to work around ponies that are small and closer
Mhm.
to the ground. And I can get this in and down around in their fetlock area and stuff like
Nice.
that, and not feel like it's encumbering the actual treatment
Sure.
by not being able to get at the correct angle because this is all.
I love that. And, we know that a lot of times horses that are injured can be really skittish
Yeah.
and to not really have any major cord or loud noises, even that little bitty fan,
Yeah.
they pretty
You
much
don't
settle
even
down
notice
to
it.
it. Yeah.
I have one horse that falls asleep when he sees me coming for his treatments because he knows that it's just going to make him feel so much better. And he especially likes his full done, and he will lower his head to where I don't have to use a step stool or anything. And he just lets me sit there for 10, 15 minutes if I have to.
Oh, that was,
And he totally.
you're speaking to the fact that he knows, he feels it. That speaks to just what we talked about in that conference last year is that small but mighty and so powerful. It can do all of the things that the big lasers can do. And I think it just underscores the fact that, you know, what we know about lasers and how they interact with the body is continuing to develop. And I love the fact that you're using this amazing laser to really kind of get to all of your patients' needs. And that's really what it's about is it's not about having 700 tools. It's about having as few tools as possible to do all the jobs.
The funny one is I feel all the little bite wounds that all
Mhm.
my geldings give each other.
Oh yeah.
Between the horse show.
Mhm.
And then we go to horse show and they don't have all these scars all over them.
That
So yeah, it's great. We love it.
fantastic. Well,
Great.
thanks so much for stopping by.
Absolutely. I appreciate it.
Thank you.
Thank you.